and that challenge to all of us to lead the nation in implementing the very best that can be offered in prevention and treatment and recovery from mental health and substance use conditions. I would like to invite Dan Driscoll and Judy Correa to come to the stage. And while they're coming, I just want to second that recognition of Loretta McLaughlin, our first friend and leader, an inspirational leader to us all.
Thank you. Jim, they've asked us to limit this, so you're not going to be able to read all that Jim wrote for you to read. Feel free. There's a wonderful phrase in Hebrew, tikkun olam. At least that's the Irish Catholic. Jim and Jean Hunt represent a partnership, the two ways to heal the world. My dear friend Jim Hooley will talk about Jim Hunt's work at the macro level. I want to talk just a bit about Jean Hunt's work at the micro on the scene level. Jean was one of the early organizers of one of the first neighborhood health centers in the city of Boston, the Neponset Health Center. Now, the folks in Neponset were responding to a crisis at the time. Many of you can remember Boston in the 60s. Time of strife, racial tension, and as doctors died and retired, new doctors were not coming into the city neighborhoods. Jean and the other neighbors that were confronted with this had a choice. They could be victimized by this situation, or they could take matters into their own hands, and that's what Jean did. They got together, they opened a storefront called the Neponset Health Center in 1970. Now that doesn't seem like such a difficult task in today's era, where there are 28 health centers in the city of Boston and 54 in the Commonwealth. But it was a difficult thing to do in that time. The model was not well known, it was not well funded, there was neighborhood skepticism, and there was even neighborhood opposition, because Jean and the early supporters insisted that this health center in the Irish Catholic neighborhood have family planning. In fact, Jean was the one who brought Jim Hunt into the community health center movement. And those of us who make our living in community health centers are very grateful for that one aspect alone. A number of years later, Jean, still on the board, participated in the creation of Harbor Health Services, which was the merger of the Neponset Health Center and the Columbia Point Health Center, the first community health center in the country. And several years after that, Jean brought her healing skills and helped heal a serious division in the board of directors of this organization. And for that one fact, I am very, very grateful to Jean. Professionally, Jean has been prepared as a nurse practitioner and was one of the earliest practitioners and proponents of what we now call community-oriented primary care. She's well known now in both state and national community health center circles. It's on a first-name basis with several of our congressmen, our current congressmen, and several generations of congressmen before them. And at Harbor Health Services today, there's a conference room named after Jean Costigan Hunt. I pass every day and think of her and her contributions. There's a wonderful book out that celebrates Boston's Irish. And on page 82, there are 4 Hunt boys. Jim Hunt, his son Jim, his son Peter, and his son Dan. Now those are the ones that got in the book. But there would be no page 82 in that book if Jean Hunt hadn't married Jim Hunt and carried to term the other 3 people in that book. I'm just very honored to have been chosen to introduce you to my lifelong friend and worldwide traveling companion. You can find the Hunts and the Driscolls and the Bradys and Sullivans and the Whites every January and February, someplace very warm. Well, I'm very honored to introduce you to and to be the one to tell you a little bit about this remarkable woman, Jean Costa.
First of all, I'm very pleased to be part of introducing Jean and Jim Hunt, and I want to thank the great Ernie Carey for giving me this opportunity. Jim Hunt has developed and run the best primary care association in the country for 38 years, and this is not hyperbole. There are 49 community health center corporations serving 900,000 people at 485 sites in Massachusetts. From very modest beginnings, their facilities today are state-of-the-art, their services are comprehensive, they deliver great care, they serve the entire community, regardless of their ability to pay, and they often are the economic engines in their communities. I myself am a patient at a community health center. The Mass League, under Jim's leadership, has created an environment in Massachusetts that has led to all of these successes. Building such an environment takes great skill and very hard work and staying power, which Jim has provided. This is not to say that the leadership of community health centers themselves are not responsible for their success, but I am saying that their success was greatly enhanced by the work and advocacy of the Mass League, and specifically Jim Hunt. That environment includes building significant status and producing meaningful results. The community health centers and the League have achieved that status within their communities, local, state, and federal administrations, with the leadership and membership in the legislature, and with healthcare leaders in Massachusetts. We have seen local, federal, state, and community investments in community health centers. We've seen tremendous growth, and we've seen innovation and meaningful community-focused programs. Jim Hunt has provided the leadership and the underpinnings for all of this. A manifestation of his leadership is that every community health center in the Commonwealth is a member of the Mass League. Not being a member means that you are not where the action is, and that you do not have access to the great Jim Hunt. I am fortunate to know Jim for all of his years at the Mass League and to work with him very closely for 10 years when I worked at Neighborhood Health Plan. I am not unique in saying that he is a great colleague and partner, abounding in energy, a very wise advisor and brilliant strategist, represents the highest ethical standards in his work, and lives a life of compassion for others. From those remarks, you would think I was his agent. I'm not, but I would like to be. So, in closing, let me say, Jean and Jim Hunt are a remarkable team, and we want to thank you for all that you do.